You're simply the best, better than all the rest, better than anyone I've ever met. I'm stuck on your heart.
Each year, ONPHA recognizes an innovative nonprofit that responds to tenant and community needs with imagination and innovation. This year, we are presenting the Award for Excellence to a pioneer in supportive housing and support services. Frontenac Community Mental Health Services is a private nonprofit in Kingston that serves people with serious and persistent mental illness. Originally established as an affordable housing program, it has evolved into a full-service mental health agency that serves over 1,000 people annually. From its earliest days, the organization has been driven by one goal: to ensure that people with serious mental illness have the opportunity to be active and participating members in the community. This goal prompted two visionary staff at the Kingston Psychiatric Hospital in 1972 to establish a summer co-op home for patients moving into the community. This goal motivated a group of community leaders to form a board for the program in 1976 and incorporate as a charitable organization. This goal has driven the growth of this dynamic organization, known first as Friends of Kingston Psychiatric Hospital, then Kingston Friendship Homes, and now Frontenac Community Mental Health Services. Executive Director Vicki Hewen says, "Client choice, dignity, and respect are embedded in everything Frontenac Community Mental Health Services does to promote the recovery of people with mental health issues. Programs and services are designed to meet the needs of people it serves, as well as evolving needs in the community." Frontenac Community Mental Health Services started out in the 1970s with several rental properties for people with mental health issues to live in shared housing. In the 80s and 90s, it expanded, purchasing these and other properties to accommodate the growing number of people leaving psychiatric institutions and in need of affordable housing. At the time, there were few community services in the area for its tenants and other people with mental illnesses. The organization found itself looking for ways to address the service gaps in order to meet its tenants' needs. In 1992, it decided the best solution was to purchase this building and develop the day program requested by tenants. From then on, it simply never looked back. As tenants asked for more programs and staff identified new client needs, the organization built a roster of integrated and connected services. Today, it has become one of the largest mental health agencies in Eastern Ontario. Frontenac Community Mental Health Services offers an array of services in order to meet the complex needs of the people it serves and support them through different stages of their illnesses. It provides housing and residential supports for 115 people living in 15 properties and 44 rental units with private landlords. It has a community support team that helps more than 150 people in Kingston manage daily living, set goals, and access the services they need. It offers programs to people in smaller communities through its rural outreach program and satellite offices in Sydenham and Sharbot Lake. For people with more acute needs, the organization has two assertive community treatment teams, or ACT teams. They provide intensive multidisciplinary care 24/7. It also provides a crisis service and a 24/7 telephone service and mobile team to assist individuals deal with crises and access the services they need to avoid hospitalization if possible. As well, it has a court support program to assist people in trouble with the law avoid the criminal justice system. Two staff work at the courthouse, advocating for people with mental illnesses and working with lawyers and judges to negotiate court diversion programs. For many clients, access to the organization's continuum of services is key to their recovery. Karen Jarvis, who has been a client for close to a decade, is one such client. She says, "I was given housing, vocational training, and the help I need to manage my illness. Today I'm married, employed in a local car dealership, living in my own apartment, and am an elected member of the board of directors. I'm doing well." In everything it does, Frontenac Community Mental Health Services works closely with community partners. At Home Base Housing, a supportive housing provider for hard-to-house individuals, it provides services through its ACT team that help people maintain their housing in the community. At a local shelter, it provides on-call services and nightly drop-in visits by the mobile team. It works closely with Providence Care Mental Health Services to help people move successfully from the former psychiatric hospital into the community. Its mobile staff go on regular rounds with local police and are on call to help with incidents involving people with mental illnesses. Police speak highly of their partnership with Frontenac Community Mental Health Service, saying it lets their staff get on with policing while letting Frontenac staff get people the mental health services they need. Frontenac Community Mental Health Services plays an important role in bringing partners together not only to provide services, but to identify community needs and develop community solutions. 10 years ago, the organization spearheaded the first Kingston area mental health and addictions coalition. Today, it is active in a regional mental health network that is advising the local health integration network and a coalition of housing and social service providers, as well as leading local, regional, and national human services and justice committees. Robert Seeby, Executive Director of Anguanata, a Kingston agency that serves people with developmental disabilities, says Frontenac Community Mental Health Services is a real leader in the community. It's an organization that is never afraid to take on challenges. By initiating programs like its mobile team and crisis service, it has significantly increased the capacity of the community. Frontenac Community Mental Health Services is simply an organization that does not stand still. It is always looking for ways it can serve people better. It encourages staff to meet regularly with clients to evaluate programs and bring forward new ideas to address their needs. Clients have significant input in Frontenac Community Mental Health Services through surveys, program groups, the Client Advisory Committee, and through representation on the Board of Directors. The organization is committed to quality service, best practices, and rigorous program evaluation. It is a leader in this regard. In 2005, Frontenac Community Mental Health Services completed its accreditation through the Canadian Council on Health Standards, with no reports. It is one of the only several independent community mental health programs to attain this standard of excellence. In 2006, Frontenac Community Mental Health Services raised the bar even higher, affiliating with Queen's University and its Department of Psychiatry. This gives the organization closer ties with leading experts and research studies. These achievements are impressive and demonstrate Frontenac Community Mental Health Services' commitment to accountability and measurability and to the people it serves. In May of this year, Frontenac Community Mental Health Services celebrated its 35th anniversary with an open house at its center on Princess Street. Clients, staff, community partners, board members, funders, and city officials were there to salute the achievements of this remarkable organization. ONPHA is pleased to honor its achievements here today. Frontenac Community Mental Health Services truly is an organization that responds to tenant and community needs with imagination and insight, shows vision, energy, and creativity in forging community partnerships and developing services, and takes risks and thinks outside the box to address client needs. It is helping hundreds of people with mental illnesses become active members of the community. Please join me in honoring Frontenac Community Mental Health Services and welcoming the close to 40 client staff and board who are here with us today.